Governor Doug Ducey says that Arizona is ready and that things are checking the box for reopening under the White House criteria. However, the number of coronavirus cases still seem to be going up.
The governor is saying that he'll do everything in his power to keep Arizonans safe. Team 12's Bram Resnick was at the governor's latest update this afternoon. And Bram, was there one thing that caught your attention today?
There was, and it was this. The governor seems to have this all mapped out. He believes we are on a steady path to a return to some kind of normal. Let's talk about some of the key things we learned today. First off, the governor wants to reopen camps and youth activities for the summer. He also believes the evidence allows the state to plan for safely restarting schools in the fall. That planning will begin, and this phase 1 reopening will continue through May and into June. That should put the state on a path to phase 2, though the governor didn't say what phase 2 is. Also, regarding the historic level of jobless Arizonans, the governor said the state has paid out more than $1 billion in benefits. Now, some employers are concerned workers won't give up those benefits to go back to work. Treasury Secretary Steve Mnuchin says those workers should have their benefits cut off. I asked the governor if he agreed.
Should they report to DES whether an employee is refusing a job?
They should contact the employee, find out the situation, and then communicate whatever the information is.
And the indication there from the governor, though he did not directly answer the question, is that yes, employers should report to DES whether an employee is taking back a job, and if not, why. If it is for COVID-related reasons, that's okay. If it's not, under DES policy, the employee could lose their benefits. Mark?
Bram, look, the elephant in the room continues to be nursing homes. You asked the governor and Dr. Kara Christ about nursing home testing and why it's taking so long to test those who live in those facilities and also work there.
That's right, Mark. Here it is. It's May 20th. We are almost 3 months into this pandemic here in Arizona. And today really was the first time we have seen a mapped out, organized strategy for testing in nursing homes, as well as testing in the prisons. Regarding nursing homes, we're only testing about 150 skilled nursing homes. There are about 2,000 or more nursing homes, assisted living centers, senior living centers. Many of those are not part of the organized testing. My question was quite blunt. I said, given how long we've waited, do you bear any responsibility for the few hundred deaths we've seen over the last 2.5 months? The question wasn't directly answered. The governor said, hang on, we've been at this since the middle of March. I can't find much evidence that mass testing has been going on in our nursing homes since the middle of March. In fact, the testing announced this week and first announced late last week is really the first sign of that. Mark?
Yeah, and I'll tell you, we continue to hear from people who have loved ones in these nursing homes. They're the most vulnerable population, and they want answers, and I don't blame them.
Absolutely not. You know, this is the most obvious thing. Infections run wild in places like nursing homes and prisons. People can't go out. They're in these fixed situations. Infections run wild. And again, today, we heard more from Dr. Kara Christ, our health services director, that they're going into all of these long-term care homes, because that encompasses a wide range, those 2,000 or more homes. They're going into the long-term care homes to check on their infection controls. 2.5 months into the pandemic.
Yeah.
Back to you, Mark.
Okay, Bram, thanks. The number of positive cases in Arizona is at 14,897. More than 300 new cases were reported today. And the number of deaths in the state is at 747. In Maricopa County, people 65 and older or those who have a chronic health condition are at greatest risk. They make up 72% of the people who've been hospitalized and 95% of the deaths.